Hi, Kansas City Moms. I'm Sarah McGinnity with Kansas City Mom Collective. And today we're going to be talking with Dr. Rachel Hailey, a board certified family medicine physician with family health specialist of Lee Summit Medical Center. And we're going to be covering a topic that's been, I feel like, in the news and in a lot of families' mind this summer, which is tick-borne illnesses and tick bite prevention. Whether you're hiking trails or just playing in the backyard, Dr. Haley is here to share advice on keeping your family safe during tick season. So, welcome, Dr. Haley. Thanks so much.
All right, thanks for having me.
So, I feel like maybe it's because of social media, but I feel like there's so much tick stuff this year. So, can you talk about just is tick season worse this year, or what are you seeing in your offices?
I don't think it's just social media. I think it definitely has increased, and I think part of it has actually been more intense due to a combination of factors. We've got these mild winters, early springs, increased humidity, and ideal conditions for tick survival and reproduction. In my office, we've seen a noticeable increase in people coming in with tick bites and related concerns. Patients have embedded ticks, rashes, flu-like symptoms. I literally last week had a 15-year-old boy make his own appointment, bring in the tick
Oh,
that he'd gotten off. I know. I was like, wow. So
how
yeah,
responsible.
I know. I thought so too. I was like, it's everywhere.
Yeah. Okay. So what are you, I feel like Lyme disease is the one that we hear the most about. But what illnesses are you seeing that do come from ticks, and what do you think parents need to be aware of?
Oh yeah, we're definitely seeing increase in several tick-borne illnesses, especially in children who are outside. Obviously, the most commonly talked about and reported is the Lyme disease, but we've also
Mhm.
got ehrlichiosis. There's a thing called anaplasmosis, Rocky Mountain spotted fever, which is horrific. This weird thing called babesiosis. But again, Lyme disease, most well-known, commonly reported that bullseye rash and fever and joint pains and headache and fatigue. So those are the early stages, and then later on, if it's not treated, those are the things that can lead to heart issues and chronic joint pain and neurologic symptoms. So ehrlichiosis is a weird one that I've actually seen in a patient, and that one, same thing, headache, fever, fatigue, but also more muscle aches, and so that can be really interesting, especially in adults. And then the Rocky Mountain spotted fever, I've seen that in training at children's, and that's horrific if it's not caught early, can even be life threatening. So yeah, there are the things that are out there and the things that we worry about, but again, just being cognizant of it and, looking for ways to, prevent and stay ahead of it so that we're not left with, something that's going on and we have no idea.
So are you seeing things that if people don't, my fear is always my kid's been bit by a tick, but I didn't know it, and then they have these symptoms. Do you feel
Right.
like you're able to, are the illnesses from ticks identifiable enough that you can
That's
know
always
what's going on, even if there's no tick bite that you knew about?
That's a good question. So that's why, just being aware and, you know, looking for the weird things like, what is this rash? Do I need to get this looked at? Especially in a constellation of symptoms of headache and fever and chills and rash. Those are things just to get checked out. Yeah. So even if you don't know it's a tick bite, a lot of times you can still see a remnant of it though,
Okay.
um, especially if there's a rash, because that rash usually circles the actual tick bite. So
Okay. And then you mentioned some of them can be long lasting. What are the options for treatment if you do
well,
identify a tick-borne illness?
yeah. I mean, we're lucky. I mean, it's really easy. Doxycycline and amoxicillin can take care of most of these things. The weird babesiosis has some parasitic component treatment, but I think that's one we really need to worry about as much as these other ones. So we've got treatment. Again, if we get it started early and not having delay, then we can prevent those long-term complications like the chronic joint pain from Lyme disease, chronic fatigue, and then the organ damage and stuff that can come from Rocky Mountain spotted fever.
Yeah.
So I know
Okay.
it's serious, I know it's scary, but I always want to reassure patients it's like we don't see them that often. We are seeing a lot of ticks. We just want people to recognize and be smart and be safe and look for the ticks, instead of just waiting.
Okay. And so I think we're kind of trained to do tick checks like after hiking or like a camp. Um, but are there ticks found like in Kansas and Missouri just in your backyard?
Oh yeah, absolutely. Yeah, the kid that brought his tick in was just out in his backyard. So they're found in backyards, usually ones that have especially tall grass or leaf piles, wood piles,
Okay.
overgrown landscaping. Ticks thrive in shady, moist environments. They can also be carried by pets or
Mhm.
animals like deer and mice and squirrels. But common zones in the backyard would include again the tall grass and brush, under decks, under play sets, and then like wooded fence lines. So, keeping the yards neat and, clean, keeping play sets away from like wooded fence lines or like the wooded areas, um,
Got it.
is also a smart thing to do.
Okay. And then other than the obvious like environmental things, how can we prevent tick bites?
Yeah, this is a key. This is the one I always like to hit. Prevention's the best thing. So, you can use insect repellents. You can use like DEET and the keratin. That's such a weird one, but also lemon eucalyptus, safe in kids. And then also wear protective clothing if you're going to be outside. I know we're not going to send our kids out in long pants and long sleeves just to play in the backyard. But
Right.
if we're going to go on the hikes and the walks, wearing the long socks, tucking the pants legs into the socks, wearing light clothing so that you can actually see the ticks better and get them off sooner. You can also treat your clothing and your gear. There's permethrin sprays that you can buy, and they can last through several washes. So that's a good one. The daily tick checks and really focusing on the hairline, the armpits, the waistband, behind the knees, between the toes. Those are good places to check. Showering as soon as you come in from play, and that's good for everything from allergies to ticks. Just wash it all off.
Right.
Is they do not use things. Um, well, scratch that. No, again, keeping the yard safe, mowing regularly, removing the tall brush, and keeping those play areas away from the wooded fence lines.
Okay. And then when you do find a tick, what is the best way to remove it? And do you need to keep that tick for testing, like your patient,
Yes, I
your
know.
responsible teenage boy patient?
I know. It's like,
Is
wow, that's amazing.
amazing.
Yes. Having a good pair of tweezers that are, fine tip so that you can get at that tick right at the surface of the skin. You want to get it right at the head if you can. You don't want to jerk it or twist it. You're just going to pull, slightly upwards with just steady pressure. You don't want to, the goal is obviously not to leave any of its parts under the skin. Cleaning the area with soap or alcohol or, iodine, and then, yes, you can dispose of it. You can flush it. You can wrap it in tape. You can save it, put it in a little plastic baggie. And then, you're going to be watching for symptoms. But do we need to keep the ticks? No. Can it be helpful? Like, just to assess the risk? Sure, but it's not necessary.
Okay.
So,
Okay. And then you kind of mentioned some of them, but what are the main symptoms that parents need to have on their radar if they did remove a tick and now they're just kind of watching?
yes, and that's the unfun part. We say watch for 3 to 30 days. It's like, wow, so then you're going to be this heightened angsty, watch my kid for all of this. But the rash, obviously, a bullseye rash or a spotted rash, fever, chills, headache, muscle aches. Those are the big ones that you watch for. But I always tell folks, just come in. It's very simple to give a dose of an antibiotic for prevention, as opposed to, oh, hey, let's wait and see. And I used not to do that. When I started early in practice, it was like Lyme disease, Northeast. We don't see it here. And now we
Hmm.
just see it creeping in. And it's like, okay, it's not going to hurt to do, just a dose. And that's what I did for the 15-year-old boy. Everybody felt better. We're good. We're along our way. You still watch for the symptoms, but you're then
Yeah.
at least not as neurotic about, oh my gosh.
Hmm. Yeah. Okay. So any last advice for patients as we like navigate? I mean, I feel like tick season almost goes all year now, but
Yes.
into the fall, I mean, fall hiking, like it's not gone.
Yeah.
So any
No, definitely.
last kind of advice for parents watching this?
Prevention. Look for all those things that we talked about, and the daily tick checks, just once overs, check it all out. If you worry, go see your provider. They're happy to see you, and just even if it's to alleviate your concerns.
Okay, great. Well, thank you so much, Dr. Haley, for your time. And if you need care for a bug bite, HCA Midwest Health offers more than 150 locations in the Kansas City area, including hospitals, doctors' offices, urgent care centers, and more. If you find a location near you at hcamidwest.com. Thank you so much.